Hi, my name is Dr. Rebecca Brown. I'm a neuro-oncologist at Mount Sinai Hospital, and my title is assistant professor. I'm board certified in neurology and neuro-oncology, and I recently came to Mount Sinai in order to start up this NF clinic, which I'm hoping to talk about today. Neurofibromatosis is an umbrella term that really refers to three unique genetic conditions, each of which causes the growth of benign tumors along somebody's peripheral nerves. The term neurofibromatosis can actually be a bit of a mouthful. So oftentimes we shorten it to just NF. And the three types of NF are called NF1, NF2, and schwannomatosis. And the latter, schwannomatosis, we sometimes refer to as NF3. They can actually be quite distinct and are caused by different mutations, and some are located on different chromosomes. For example, people born with NF1 may have many birthmarks that we call cafe au lait macules. They also commonly have bumps in their skin starting in late childhood into adolescence. And they can also grow larger tumors deeper in the skin that are called plexiform neurofibromas. Children with NF1 are also at risk of a tumor that grows along their optic nerve, which is the nerve that leads between the eye and the brain, and can cause decrease in their ability to see. So alternatively, people with NF2 usually don't have any outward signs of their condition. They're predisposed to tumors that grow along the nerve that connects their ear to their brain. And so the number one side effect that we look out for in these patients is hearing loss. Finally, NF3 or schwannomatosis can cause the growth of benign tumors along the peripheral nerves, very similar to NF2, but it isn't as frequently associated with hearing loss, and certainly not hearing loss in both ears, which is a risk with NF2. NF is a complex disease, and that's not an easy question to answer. Bothersome tumors can sometimes be removed, but NF is not just about the tumors, it's about the whole person. So I see my role as listening to a patient's concerns and to be the central point person for any NF-related medical issues that arise, and then we tackle them together one-on-one. So the field of NF is rapidly improving. We have so many more options and expert guidelines now than we even did 5 years ago. It's really important to see a doctor who has a passion for keeping up on these new recommendations and who can help a patient and guide their health both now and in the future. There are several trials open to treat various aspects of NF. I strongly encourage my NF patients to look into trials not only for their own sake, but also to help scientists and physicians learn so that we can develop newer and better therapies. This is a great question. I like to say that I don't really see patients at my clinic, I see people who happen to have NF. So the focus of my clinic is on the concerns of the patient first and foremost. I also serve as a hub so that I can connect patients between myself, who will oversee all of their care, and any of the many specialists who they might need to see for their neurofibromatosis. My clinic is also unique in that we see pediatric patients all the way up through adulthood. So we can also accommodate families since NF is a genetic condition. My colleague Praveen Raju and I are open to see all patients. Oh, it's quite simple, really. The phone number is 212-824-8579, and I welcome all referrals, either for transfer of care, for a new diagnosis, or else to just serve as a specialist who can help guide the patient's care at their existing physician.